Welcome to Planetary Health First, Mars Next. I'm super excited today. We have he's got so many words to describe him. He's very eclectic with everything he's done, but he goes by Ben Doc Askins. And I think that's kind of an interesting, I wonder if that's a pseudonym because he's a therapist. So, ask him or Askins. But anyway, I'm so glad you're here on Planetary Health First, Mars Next. And can you just do a little share of who you are, just as we were talking earlier?
Yeah, it's funny that you mentioned the wondering if that's a pseudonym thing. I kind of make a little joke in my book about how my name's Ben Askins, but that's just a pseudonym that somebody wrote on a birth certificate once upon a time. It's a mystery who we all actually are, right? I am I use the nickname Doc because I like paradoxes and mysteries and confusing sorts of things like that. It's a nickname that I earned spending a decade as a combat medic in the Army National Guard, including a deployment to Iraq. And then I have a medical license as a physician assistant, so I'm not technically a doctor, but everybody calls me Doc. And that's really confusing. And I like the fact that it's kind of confusing and keeps people on their toes. It's sort of controversial, like who gets to call themselves a doctor and who doesn't. Even, Dr. Jill Biden got herself into some trouble around an honorary doctorate versus a real doctorate. And I have an honorary doctorate, but it's confusing the way that we abbreviate that, right? It says PhD on HON period. And that sounds like you graduated with honors from a very difficult program. And an honorary PhD is basically a placemat. It's a certificate that somebody gave you for being a cool person. You did not do anything else, or maybe you made some large donations to a college and they decided to give you an honorary doctorate for that. And I'm just trying to highlight a bunch of the ways that healthcare and the military and life in general can be a bit ironic and confusing and psychedelic with or without any medicines involved.
Mm-hmm. Well, I just stumbled across you, and I think it was on LinkedIn. I wish I was using other platforms because I think I'm getting too much of Capital One. No, I'm not interested in this one. And because I hate to say it, old media is really challenged with the ROI. Whether it be YouTube. Like my brother gets YouTube TV or whatever, and he watches all the sports. And so now he's getting such well-placed ads. So I'd hate to be all those big media. So more power to us trying to create audiences. But so I was lucky enough to stumble across what you're doing. And I was like, man, I got to have this Doc guy on, and so really, and it's, the interest was the psychedelics. I think there's so much interest there. And it's been so, I don't want to say like voodoo and so, but you as a veteran, and you as a physician assistant, you're doing, tell me a little bit about your place there and sort of some of your work. I think it's really important. And I'm just speaking this from a voyeur, if you would, just looking at what I've heard and read with the PTSD with our vets and the powerful documentaries that I've seen, just that the evidence is really powerful, how it's radically helped people that couldn't function to a point where they were radically transformed. And I know we need more research, but I'd love for you to just share your journey and sort of what you do. And I know you do a lot of things. You have a lot of different backgrounds, but just sort of there.
Yeah. So I was fortunate enough to get selected to go through the military's PA school. They call it I just realized I got my jacket on. The Inter-Service Physician Assistant Program is where all of the branches of the military send folks that get picked to go through a 29-month program, at the end of which if you graduate and finish your boards, you get a medical license. So as a physician assistant. So I went through the PA school program and went directly into psychiatry afterwards. I had a background in emergency and wilderness and tactical medicine, both in the civilian world and in the military, and thought that I would just continue down the emergency medicine track, and then lost a friend to suicide while I was in the second phase of physician assistant school working at Fort Campbell. And the day after I got the news about losing my friend, I was working in the ER, and an intentional overdose was brought into the ER that day. And I was just confronted 2 days in a row with this, what is a pandemic essentially of mental health crisis, the level and rate at which human beings in America at this point are dying by suicide, much less the stats around veteran suicides seem to be at a much elevated level, and the actual numbers there seem to be higher than previously reported. It used to be 22 a day, and it seems like some decent studies have revealed that it's closer to 44 a day, right? So being confronted with that, which is, having a frank conversation about suicide might not be what you were looking for.
No.
Essentially, that's, one of the most basic instincts that a human being has hardwired into our nervous system. Like if you and I were in the same room and I wrapped my hands around your neck and came at you, you would fight tooth and nail to try to escape or to kill me in response, right? And it would be automatic. You wouldn't really think about it. It's the gas pedal on your autonomic nervous system. Your sympathetic nervous system would get stimulated. It's that fight or flight adrenaline response, right? And how much do you have to suffer for how long before that gets overridden, that basic biological drive to live? And it's the person themselves that wants to end their own life. That's a lot of suffering, right? And a problem that severe and that big doesn't happen typically overnight. It's a chronic stressor sort of thing. And then there's a tipping point, right? There's a divorce, or there's a loss of income, or they've been suffering and struggling for a very long time, and then they have access to things like alcohol that create non-ordinary states of consciousness, or sedatives, or those sorts of things. And once you get into that headspace with those particular substances involved, that's where we see people finish in the act of dying by suicide, right? And one medicine that in my initial hire out of physician assistant school was a doctor here in Louisville, Kentucky. Dr. Robert Stewart hired me straight out of school into psychiatry as a specialty, which is rare. I was pretty fortunate that he was willing to take me under his wing and show me, how to work in a medical specialty where physician assistant school focuses on primary care and gives you kind of a general medical education and the opportunity to specialize afterwards if a specialist will hire you. He was doing ketamine assisted therapy out of that office, and I got to kind of cut my teeth. I graduated in January 2020, finished and got my license in February of 2020. And you probably remember March of 2020 was when we decided to shut down the world for a very extended period of time. And a whole lot of people were stuck in their homes and not allowed out because of the COVID pandemic and the various public health emergency procedures that were decided to be put in place at that time. So I wound up having to manage a large number of patients, outpatient, that you might have wanted to hospitalize because we were worried about whether or not you can put somebody in a hospital while the COVID pandemic's going on. And we were able to manage some very acutely suicidal people with ketamine assisted therapy. Ketamine being an FDA approved anesthetic medication at high doses. It'll put you to sleep so we can take out your appendix. At very low doses, it has some pain relief qualities. And then at this in-between sub-anesthetic dosing, there's been some psychiatric literature produced since about the late 90s out of schools like Yale, where it seems that ketamine is a rapid acting antidepressant and has rapidly acting anti-suicidal properties. So it's a good interventional psychiatry drug. It may not have at least in the clinical trial data, the durability of efficacy of some of the other psychedelic medicines that are being studied right now, but it has the benefit of being legal off-label to be used in psychiatry. So that's the medicine that I use in the various private practices where I collaborate with my supervising physicians to do those sorts of things. So I've got quite a bit of experience using ketamine clinically with those doctors' supervision. And then I was building up my private practice with Dr. Stewart, and I'm also still in the Army National Guard. About the time that I was starting to learn the ropes and get things going, my unit got a notification of sourcing for a deployment to Kosovo. So I spent the latter half of 2021 and then the first half of 2022, getting ready to and then deploying to Kosovo on the KFOR mission with an infantry battalion out of the Kentucky Army National Guard. So I shut down my private practice and got kind of the carpet pulled out from under my business at that point and deployed with those guys, and came back from that deployment. And 3 months later, I went to the Multidisciplinary Association for Psychedelic Studies, or MAPS, training to do they're training folks to do MDMA assisted therapy for post-traumatic stress disorder. And MDMA is another medicine that's interesting, especially at this time, to be talking to you about, because it is a Schedule I medicine, which means that it's supposedly has no therapeutic use. It's been a Schedule I medicine since 1985, and it's better known by some street names where it's used by ravers as a party drug called Molly or ecstasy, or some of those sorts of names. I think it gets called Adam, just rearranging the letters MDMA, which stands for 3,4-methylene dioxymethamphetamine, which is a unique psychedelic substance as well. And it was just late last year that MAPS submitted the investigational new drug requests and all of the paperwork to the FDA to look at rescheduling that medicine in combination with therapy. And it was also in December that the National Defense Authorization Act was passed December 23rd, and as part of that bill, through bipartisan efforts of Alexandria Ocasio-Cortez and Dan Crenshaw, reaching across the aisle and working together to try to get MDMA-assisted therapy for active duty soldiers. Now, what that'll look like, nobody knows. There was also part of that bill for the VA. For a lot of civilians, there doesn't seem to be a difference. Nobody knows the difference between a veteran and an active duty service member for some reason, but there's a big difference between the VA and the DHA and all of that. But everybody's waiting to see exactly how that'll get rolled out. As far as I know, I'm one of maybe 2 currently serving members of the Department of Defense that has the training to do MDMA assisted therapy for PTSD. And you had asked about, when we were talking offline before this, about some of the evidence around, that medicine. And I was saying ketamine's a very rapid acting antidepressant, anti-suicidal med. It helps people to get very quickly undepressed. And then I will refer to a network of therapists. I have a couple therapists that I work very closely with here in Louisville that are great. Shout out to Monica Hurt and Jim Klein's here, both marriage and family therapists who've got their certificates in psychedelic assisted therapy as well. So they'll do ongoing therapy where I'll do a lot of the medical supervision and providing of ketamine services. The durability of the effectiveness of ketamine seems to be relatively limited. And that's one of the big differences when we look at the data around MDMA. So a course of MDMA assisted therapy looks like a co-therapy dyad. That means 2 therapists working with one individual for approximately 40 to 50 hours of total therapy time during a short period on a calendar, which in the clinical trials, it was 3 medicine sessions, which are a day long. They're about 6 to 8 hours of a non-ordinary state of consciousness, a psychedelic experience with MDMA. There are about 3 60 to 90 minute preparatory sessions before any medicine is given, and then 3 integration sessions of 60 to 90 minutes done in a cycle of 3 times. So it can take 2 to 3 months to complete a course of MDMA assisted therapy. And that's a lot of therapy for one person to undergo. But what they saw in the treatment arm of the largest studies, phase 3 trials with MDMA, was people who were maxing out the standardized scales of post-traumatic stress disorder symptoms, the people who are suffering the most for the longest, who've already tried several trials of treatment as usual and are still, very, very high on those scales. About 2/3 of them no longer met the diagnostic criteria for PTSD. If they were walking in the door and didn't tell you their history, they're sleeping well. They're not hypervigilant in crowds. They're able to relate better to people. They're not losing their temper. They're not having all of the arousal symptoms and all of the re-experiencing symptoms of PTSD at the same level that they were having them before. We call it being put into remission, because we're not allowed to use the word cure in medicine, because who knows if it's coming back or not. We can't time travel, right? But 2/3 of folks who were suffering as hard as you can suffer with PTSD no longer met the diagnostic criteria. And then again, at 6 months and at 12 months, without any further medicine going on, just ongoing therapy, those people still no longer met the diagnostic criteria. So the durability of the efficacy with MDMA is something that is unparalleled in the history of psychiatry.
Wow. So we're talking 70%, almost 67% within 6 and then a year afterwards. And what was the cohort? What's about the population that was studied?
Yeah, the study, and I'm not remembering, it's about 300. It's not a gigantic study, but it was a multi-center study. There were 3 different centers at which this was done. And you can imagine doing, 40 to 50 hours of therapy with that number of people. That's a massive undertaking to try to accomplish.
Oh, yeah. The clinical trials, the CROs to try to get engagement, patient engagement. I mean, that's, to me, that's like phenomenal. 300 is a meaningful, pretty significant size. And where was that out of? It was one university, one research center, or multiple centers, or?
So there was a center in Canada, a center in the States, and a center in Israel for that particular phase 3 study. Yeah.
And so at this point now, do I call you Doc? Can I call you Doc? Or
yeah. Yeah, it's what all my friends call me, Michael.
What's up, Doc? What's up, Doc? So I'm really super glad you're here. And I just am blown away by what you're doing, your work. I just feel like there's so much that's like, irregardless. I mean, not to, the suffering, mental health, and the lack, even with, with what's going on with social media with our adolescents. I mean, just, not to be, to lessen what veterans, of course, the stress that they go to, but we have a mental health crisis here in America. And I just think we need more effective treatments, and the typical SSRIs, the typical way we do it is not as effective. And I think one of the reasons why I wanted you here is just to create and to accelerate the awareness and have more of these conversations. And so I'm so glad that you're like one of 2 that are doing this. Like, you're legit, that's the other thing, that there's such a delegitimizing factor that's gone on. Some of these have been scheduled 1. I'm not trying to create a conspiratorial sort of thing out there. But there is big money for ways that have been done, and it's just way industries are. So I hope that we can make more inroads to get this out to really, where do you see that as a commercialization, getting this going? I know that's a big question, and you don't, anyway, I'll stop.
Yeah, it's a question that everybody kind of wants an answer to at this point, right? Is the access question. How do people who need it the most get access to new medicines? And the current treatment model being largely driven by your financial ability to access those medicines definitely creates limitations, right? Because the people who are suffering the most are also the people who are missing the most work days, losing their job over the level of suffering that they're enduring. It's the people who need it the most that can afford it the least. And how do we try to bridge some of those gaps? There's, creative ways to do it where nonprofits try to raise funds, or there's grants available, but that's getting just a tiny percentage of people, honestly. To get access to these medicines now requires travel internationally. There are clinics in, Mexico and in South America, and depending on the particular psychedelic medicine, but the ability to travel internationally is not something that's available to the vast majority of folks. And what exactly is it going to cost whenever this new brand medicine gets rolled out, hopefully later on this year? And honestly, even if the medicine itself was relatively inexpensive, which I don't anticipate it being, no, new brand medications get rolled out all the time and nobody can afford them for however long it takes until you can get a generic made around all the rules of how patents and stuff work. So I don't expect it to be inexpensive at first, but I don't have any idea what the cost is going to be. And then it's the amount of therapy that's required as well. Just the amount of time that you need the attention of two professionals it's a significant amount. People are speculating anywhere between $20,000 and $40,000 for a course of MDMA assisted therapy. I do not know if those numbers are accurate or not. I'm not an expert in that particular arena. Those are just numbers that I've read speculated out there. Now, looking at what's available data around like quality adjusted life years and the amount that someone who was maxing out a PTSD scale score and then for 3 months for whatever tens of thousands of dollars, you go into significant treatment and then you wind up being in remission thereafter. The improvement in quality of life, the amount of income that you may be able to generate compared with if you were continuing to be teetering on the brink of homelessness or whatever the case might be. It seems like that might be the kind of data that you can take to the insurance payers and be able to make some headway on. This will, save money for your investors in the long run. If across, 70 years, somebody's feeling better for the last 50 instead of just suffering and struggling and doing treatment as usual. But we need that kind of data head to head showing here's how much treatment as usual costs. Here's how much this new treatment could save you if we're going to be able to make this broadly available to the masses. Does that make sense?
Yeah, no, this is great. Obviously, you can already know that there's ROI. It's just the will, the infrastructure, all the different hoops. But how in the heck did you get involved in this?
Yeah, that's a great question, because I was a straight edge kid in high school. I did no drugs. I had my first beer on my 21st birthday with my dad. All my friends did drugs, and I was like, "You guys are boring until you're on drugs." I didn't really need them. I'm more like, Salvador Dali has this famous quote: "I don't do drugs, I am drugs, man." So that's kind of how that kind of resonated with me. It's like I'm a pretty happy guy for the most part. I don't feel like I need a ton of psychedelics, right? To change my life or anything. But I just kind of stumbled into it. Same way you said you kind of stumbled onto me on LinkedIn. I just kind of, I first was trained on the use of ketamine as a combat medic. We get information around using it as point of wounding anesthesia. And there's actually been some interesting case study level publications by Dr. Andrew Fisher, about using ketamine at point of wounding, reducing potentially PTSD for people, and even just getting enough pain management at point of wounding, reducing PTSD in patients later on who got, polysystems trauma and some of that sort of stuff. So I'm a big nerd, maybe is the,
I see that. I see that. I just, when you started talking, I was like, I'm not going to be talking at all this show. This guy's like got a photographic, whatever. I don't know what the term is when you just had auditorial, whatever graphic memory. It's just like rolling.
It just sticks in my head for whatever reason. Yeah. I read a lot, and it seemed like the stuff that I was reading said that this is going to be the cutting edge of mental health care. The famous quote from the LSD researcher in the 20th century, Dr. Stan Grof, is that what the telescope was for astronomy and what the microscope was for biology, psychedelics are going to be for psychology. There's a way in which not only will we be able to heal people with medicine who are suffering, but that we may be able to get insight into what it is to be a human being in the first place in psychology in a way that just hasn't been readily available, at least in the West, because of being outlawed back in the war on drugs, the misbegotten war on drugs in the 1970s. You'd asked about access, and I just wanted to mention, I guess in passing, this is kind of beyond my purview. I have a Master of Divinity degree that I got with my GI Bill along the way. Like I said, I'm a big nerd. I like reading, theology and philosophy and science.
And before I forget, Doc, I want to have you come back on. I feel like this is just a start. I feel like you're like a time traveler. I feel like you know, this is part of planetary health first, Mars next. I mean, we are in the universe traveling,
Yeah,
and
absolutely.
we're trying to create purpose and meaning. And to me, the whole value is, you know, bring a friend and let's create a you know, a robust discussion.
Well,
And this is just the tipping point. I
I-
mean, I got to tell you, nothing against all my other guests, but it's rare. It's a rare earth. You're a rare earth metal occurrence. And what you're doing, the energy and the gravitational force that we need in this world is here. And so I want to have some of your colleagues or whoever else and love to do a panel. And I know what's cool is we're talking and you're like, oh, are you on a show or he's coming on your show, Dr. Owen Muir, who I've had. I mean, he is so powerful. The guy came on and my thing crashed. I mean, we were having
shut down
stuff.
StreamYard.
Yeah, he shut down StreamYard 7 times.
He's the frontier psychiatrist. That was one of my favorite techno songs when I was in high school. Frontier psychiatrists. Anyway, yeah, he's coming on. I have a podcast. It's called Anti-Hero's Journey. I managed to hoodwink some pretty cool people to come let me interview them on there. If people want to check that out, it's all over the place. And then I wrote a book by the same name called Anti-Hero's Journey that you can get at antiheroesjourney.com or on Amazon. It's my life story told as if it was a psychedelic assisted therapy session. I try to make it, it's a bit of a trip. I got a blurb it's got a 5-star review from a 3-star general. It's like the only 8-star review in the history of the world, man. Like it's a decent book. Like, you know, it's fun.
Yeah.
It's intended to be kind of mind opening and mind bending. And it's kind of warped in like I'm trying to channel Hunter S. Thompson a little bit.
Yeah, I need to get it. I'm sorry I have not read it yet. I just
no
got you, and so I see it. It's freaking awesome. It's
I think
like
at this
you
point,
read it in
like,
2 weeks.
yeah.
You wrote it in 2 weeks, right?
Yeah, I was having it. Well, at one level, it felt like it took 2 weeks. The other level, it felt like it took 42 years because I wanted to kind of get this out, and it wound up just kind of flowing at one point pretty easily. So
it was like almost like what would you call it? It's almost like a divinity. Like, I mean, what do you call it? Like a catharsis? I mean, it was just like sort of like you were spiriting it, or I don't know, whatever the word is. You're better than me.
Yeah, people call them downloads. I did have a significant non-ordinary state of consciousness induced about 2 weeks before that, and just trying to integrate having that non-ordinary state of consciousness wound up being like a narrative review and just kind of throwing it on my, you know, everything down on paper as fast as I could. I couldn't sleep until I wrote it, was kind of how it felt. I don't have any bipolar history, but it, you know, would have resembled a manic episode of writing at least. Like, I can't sleep, I got to write, and I got all done writing, and I slept great, right?
So you were on a handle, like doing the Messiah, right? That was a handle-esque experience.
Yeah. You know, that's a good connect. I don't know that I would say it was this particular piece of literature is on that level of the Handel's Messiah by any stretch of the imagination, but I appreciate the connection between, like, he had that burden of needing to create that, and I had that burden of needing to create this book for whatever reason. But I did want to mention in passing that there's a bunch of routes to gaining access to psychedelic medicines, right? There's the medicalization route, wherein, you know, in the most controlled environment with the most thoroughly trained professionals, you gain access to quality therapy. And that's one way. The other way is legalization, wherein it's simply like Proposition 122 out of Colorado, where people are allowed to grow mushrooms and own mushrooms, and all of the rules are still kind of being rolled out around what that will look like and how much you can and can't grow, and what does selling it look like, based on a lot of their lessons learned from a decade ago of changing cannabis rules in Colorado. I think that they've done, you know, as a non-attorney reading from the outside, they've learned a bunch of lessons from the cannabis industry and are trying to roll out psilocybin use, that's magic mushrooms, in Colorado in a safe and intelligent way of legalizing those.
And where are they with that? Where is that gonna? I mean, with that?
Yeah, so they just published, I think it was maybe like a week ago, a bunch of the rules of what they're expecting to do as far as where treatment centers will be available and what will be required in order to, own a store where that's sold, and what is going to be certification looking like for people who are going to sit for trips and all of that sort of stuff. I forget the name of the piece of legislation, but there's some links to it on LinkedIn. That I just reposted maybe a week ago when that came out. So then there's also decriminalization. Last summer, I was at Psychedelic Science 2023 out in Denver, just after they had decriminalized owning psychedelic medicines like psilocybin or peyote. And all that means is that whoever, the mayor of Denver decided that we're not going to allocate any more law enforcement resources towards enforcing what are still laws on the books, right? That's what decriminalization effectively means. So then in the convention center in Denver, there were people like selling psilocybin right there, right? Like, well, it's decrimmed, and hey, sure enough, I got a, tent that whatever. I was there hawking my book, trying to get people to read it, wearing a Deadpool costume, just because that's fun to me. And a ton of people wanted to like take selfies with me, and they were giving me like 5-gram psilocybin chocolate bars in exchange for a picture with Deadpool. And I was like, I don't know what to do with this. I just gave them all away to other people or whatever, right? Because like I said, I'm a pretty happy guy. Don't feel like I need to go chasing that dragon or anything. But it was pretty fun. The fourth route that doesn't maybe get as much attention because of the legality, the questions around it, is ceremonial use. Like, this has been the medicine of
freedom of
indigenous
religion,
peoples, right, all over the world for a very long time. It's the old sort of hippie argument, like, it grows in the dirt, man. How are you going to make it illegal if it grows in the dirt, right? Like, that's not cool. But these have been the medicines of certain people groups in all over the planet, particularly in the Western Hemisphere, and how they've approached using their sacraments in those traditional contexts is a way to gain access. And then there are religious communities of all sorts in the United States who are seeking legal protection under the Religious Freedom and Restoration Act to use psychedelic substances as their sacraments, which, here in America, it's always the wild, wild west. It doesn't matter what century we're talking about, right? So there's plenty of psychedelic religious communities and churches showing up all over the place. And, it seems like, like anything else, and I'm not advocating for any particular one of these. I think the mantra that I hammer on in my book over and over again is think for yourself or not at all. You need to figure out what context is going to be the context wherein you can do the most healing. I don't know what your history is or what your story is or why you're pursuing this at that time. It may make the most sense to try to find a ketamine-assisted therapist as soon as possible because that's legal. Or it may make the most sense to you to go join a mushroom church somewhere. But, buyer beware, do your homework on everyone. Like your mom told you when you were little, be careful what you put in your mouth. There are consequences for that, right? There are mushrooms that taste like steak. There are mushrooms that'll show you the face of God, and there are mushrooms that'll kill you right now. And, telling them apart isn't an easy thing to do. So be careful with all of that.
Well, Doc, I'm so glad that you stopped by and just love what you're doing. I would love to have you on with a friend, that's driving this, that you feel like could add another kind of perspective. Who would that be? Not to put you on the spot, but yes, I'm putting you on the spot.
Somebody who I've invited on my podcast several times is an old friend of mine. Her name's Dr. Sarah Bliss Matusik, and she and I do, when we do episodes together, we call them bluff episodes, bottom line up front. And we just review latest and greatest psychedelic research papers as they're getting published and try to, she's a super duper science nerd, even above and beyond what level I could get to. And we try to kind of chop it up in a way that makes it accessible to the average person and is clinically useful. So she and I really enjoy having, conversations around the science of these sorts of things. But there's a whole network of physicians that I work with, who also have recently completed training in that regard. So doctors like Matt Dawson, Mike Stone, Mike Mallon, Carl Seeger. We all work together at a company called Wild Health. So any of those guys would be great candidates for guests on your podcast, or to come back on with me to have a conversation. Anytime we get some of those knuckleheads together, we all have a really good time talking about, having a good time and healing the world. And I appreciate you, inviting me on. I really like the planetary health first, Mars next thing. Did you know that like the human circadian rhythm seems to be more synchronized with the way that Mars oscillates rather than the way that Earth rotates? Are we all Martians? I don't really know, man, but those are super interesting questions, right?
Wow. I love that. And where the name came from. I mean, you know how when you do something, they're all like, what is that? Wow, who's your audience? It's like, at this point, just watch it. But it is the name. I've been told many times, like, you need to shorten it. But it's like, and then I love it. It is what it is. And I will tell you that is a Russian satellite photo of Earth.
Okay.
So however I got that, I can't even remember how I found that photo, but it's from one of the Russian satellites. For whatever reason, it had more dirt and more land, and it seemed a little more vibrant than ours. So a little different. So I'm not a communist, nor a Sovietist, or a Russian operative, or a CIA operative. I'm American, but I'm big on us all getting along in the universe. And Doc, it has been awesome having you on. And so hopefully we can find a time to get you and some of your other, psychonauts. I don't know. What do you call it? You're like, what do you call these people?
Yeah, people use that word, but it's usually for people who have a lot of experience with ingesting the medicine.
Okay.
And I wouldn't even qualify as like a cadet in the psychonautic, Space Force or whatever, right? But there are some folks out there that would.
Yeah, I have no idea. I'm like you. I mean, I've done stuff, but none of that stuff. Coffee and others. But then my wife's, you need to just calm down. Sorry.
You could, if you wanted to talk to somebody who has a lot of experience with the medicine that, there's a fella, Eric Osborne, runs a psilocybin church here in Kentucky. He'd be somebody who would have a unique perspective compared with my own that you might want to reach out to on LinkedIn and see if he'd want to be a guest here. He could probably talk more intelligently about the Religious Freedom Restoration Act and some of the ways that, religious approaches to psychedelics would be available to you. He and I've had lunch once. He seems like a cool dude. You might really enjoy it.
Yeah, that could be cool. This has been great. And I hope to meet you sometime in person. Some of these conventions and conferences you're going to just seem like I don't even have to get to Elon getting this stuff to Mars. Just go to those places. I mean,
yeah. You can do it in the safety of a clinic or, a church or a sweat tent or whatever might be out there. Yeah.
All right. Well, we're gonna land the plane. Ben Doc Askins, it's been such a pleasure for you coming on. Is there anything you want to shout out to your audience, to people, to message while you're still here, while we're finishing this up?
Yeah, absolutely. So if you're looking for primary care, go to wildhealth.com. It's the cutting edge of healthcare in America, and you can get 20% off of your first year of membership at Wild Health with the code DOC, D-O-C, in all caps. That's me. And then if you want to work with me, if you live in the Louisville, Kentucky area and you need mental health care in a private practice setting, you can go to advancedpracticeproviders.com. And that's how you get a hold of me there. And then if you want to buy my book or download the audio book, you can just go to antiheroesjourney.com, and there's links there to all of that stuff. If you want free stuff, I'm throwing podcast episodes out there all the time. So join me on the Anti-Heroes Journey if you dare.
Awesome. Well, this has been great. Thank you so much for joining us on Planetary Health First, Mars Next. Until next time, friends, I hope you enjoyed the journey, and peace be with you.